Good morning. It's still morning, but before I start, I know some of us have already started to have our lunch, but let us take a moment to just say our blessing. In the name of the Father, and of the Son, and of the Holy Spirit, amen. Bless us, O Lord, and these thy gifts, which we are about to receive from thy bounty, through Christ our Lord. Amen. Enjoy your lunch while I'm talking. I want you to know, my name is Mayra Thompson, Mayra Jimenez Thompson, for anybody who's interested. I am of Hispanic, Mexican-American, and bilingual. So I'm happy to see all of you here. I have a lot of information. You all are going to get copies of my slides. What I'm going to talk about is an introduction that's actually going to have all of you have more questions at a later date. And I want to tell you that there are certain groups that are available to answer your questions. The most important one is the National Catholic Bioethics Center, which is in Philadelphia. They have a website, and it's at the end of your slides. And any question you have, you can call. It's a 24-hour hotline. You can email, and they will get you the answer. That's the most important thing you should take today, because the rest of the information, you can always call our Catholic Medical Guild here in Dallas. We have a website. You put a question on the website, it will get answered because it's run by my husband, who is a type A, and he sits up at night until he gets everything answered. His name is Jeff Thompson. So you are not lost. We will answer everything we can. We are both Catholic, and we follow true Catholic doctrine. So that being said, let's talk about today. What are we doing today? We're talking about the ethical religious directives and end-of-life issues that have been put out by the Catholic Church. It's a lot of fancy words, and basically this says, what does the Catholic Church say when it comes to the care of the ill and of all the people that are poor? When we consider medical treatment, and you know, I am a medical doctor, I'm an OB-GYN by training, you have to consider that we must respect science, but science must follow a good conscience, because if it doesn't, it can only lead to man's ruin. We have to remember what happened during Nazi Germany. During Nazi Germany, there was a lot of experimentation on human beings and a lot of inappropriate care of patients and a lot of disrespect, killing of innocent people in the name of science. And we cannot allow this to happen. If we're Catholic, we can't. And if we are any form of human life, we should not allow this, because we are human. And what we have to remember is that when we talk about who we are and what kind of treatment we should always follow what is ethical. And what is the definition of ethics? It is a set of moral issues or aspects, such as rightness, that we must follow. It's interesting, this is the direct definition taken from the Merriam-Webster Dictionary. I have to always chuckle about this because I am old enough to remember, as I think quite a few of you are here in this room, what the Merriam-Webster Dictionary was. Remember, we used to take it out. A lot of young people nowadays don't really know what that is, but what I'm going to be interested in seeing is what happens in the future when we don't have the hard copy of it, what is used. And it'll be interesting to follow what this definition is then, if it's kept or if it's changed. And when you look at ethics equal morality, that's what it says in the dictionary. What is the definition of moral? Well, it's relating to the principles of right and wrong in behavior. And these principles are looked at in the expressing of these principles, the confirming of these principles, and whether or not they're sanctioned or accepted. When we look as Christians at human life, we know that we believe in protection of human life from the beginning to its natural death. The new term is womb to tomb. We know that we are made in the likeness of God, and because of that, we have a special place in the world and in existence. The human life has to be respected and protected, absolutely, from the moment of conception. There's a lot of argument nowadays about when does life really begin. But I can tell you as a biologist, and when I studied that as a medical student, I remembered that I could tell that something was alive when I looked in the slide and the cells were reproducing. I knew that that was a living entity. If it stopped reproducing, I knew at that point that death had occurred. So when you think of starting life in the beginning, we know that there is a replication or doubling of those cells, and we know that there is living tissue there. That because of our Christian belief, we know that that is a human life. It is destined to be a human, and therefore we respect that that is what God has determined to be a human, and it has to be something that we must protect. Another thing is we also say that human life represents personhood. Personhood is a very important term. A person has inalienable rights in conformity with the plan and will of God. It's interesting that when the Supreme Court looked at the language of all these legislation regarding human life and the voluntary interruption of life, they looked at the term personhood, and they have tried to identify it because that's how they determine that we are valuable. So, what does the Catholic Church say? We are familiar with the Catechism of the Catholic Church. It's a nice thick book that describes everything that you need to know about the Catholic Church's stance on certain issues. And in number 2270, it clearly says a human life must be respected and protected absolutely from the moment of conception. And it says that for the moment of his existence, a human being must be recognized as having the rights of a person, again, personhood, among which is the inviolable right of every innocent being to life. This is repeated, of course, in our Constitution. It says in the Catechism, science and technology by their very nature require unconditional respect for fundamental moral criteria. We just mentioned that earlier. They must be at the service of the human person, of his inalienable rights, and of his true and integral good in conformity with the plan and will of God. Ultimately, the will of God is for us to exist, to live, to be happy, and from what I can tell, to be healthy. Again, let's go back to personhood. It respects the dignity of a person, and it depends on the understanding of what the term means. It involves the idea that a person who is an individual, that is what humans are, is one of a rational kind. That means that you can rationalize. Humans can, animals cannot. In other words, you can teach a dog to do different things. You can teach a cat sometimes, although they're a little bit more finicky. But you can teach a dog to go and get something. You can teach them even to pick up cocaine and other drugs and look for gunpowder, whatever. But you have to teach them by repetition and giving them some kind of encouragement, which we call treats. But they cannot rationalize why they're doing it. They can only repeat what was taught. And we think that our kids, when they're little, can do that. We try to take that approach because they're a little bit harder to rationalize with. Now, Johnny, you shouldn't be doing that. Johnny doesn't understand it. Johnny understands yes and no, and maybe punishment or reward. But once Johnny gets to the age of reason, which we all know we eventually do get to it with our guidance, Johnny starts to learn what is good and bad based on its own inherent knowledge and deduction that he has in his own brain. And that's what humans can do. And because we have that ability, it sets us apart, and that is why we say that we are persons, okay? So again, the definition relies on the capacity of rationalization. What is the role of the church? Historically, the role of the church has been very integral to the care of the ill. In particular, the role of the church early on, as early as 300 AD, St. Basil started the first church in Caesarea, which was out in the area of Palestine. And what he did is he started a hospital or care of the poor and the people who were not being taken care of by the Romans. And the reason is the Romans had so-called hospitals to take care of their soldiers, their elite, and also their gladiators, because they were valuable. Gladiators were valuable. But the poor and the normal people were not. So the Catholic or the Christian church at the time started the first hospital. And throughout history, this was again continued. So the Catholic Church has a big role in the care of people who are ill. It's interesting too that there's the Mayo Clinic, which is quoted by everybody, okay, was started by a set of nuns who got together with two brothers who were doctors, the brothers Mayo, started a very successful research institution, which now is not recognized as a Catholic institution, but it was founded as a Catholic institution. So we have a big role here that the Catholic Church plays. And what does it do currently in today's age? Today it supports healthcare ministry in many forms. It collaborates with those working to improve the health of the congregation. It does provide clarity in problematic situations before and after birth, throughout life, and as well as at the end of life. And the Catholic Church does give you specific guidelines. You just have to look for them. You have to ask the right people. In many ways, there's not a gray area. There's a lot of very predetermined rules on what should be done, but always in respect of human life and dignity. And it is committed to the education of the clergy, of the moral issues, as well as new technology. And that has become more and more important because today, the clergy is very much someone that we depend on for clarity. We go to our parish priest for advice. And let me tell you, these guys are not doctors. They are not scientists. They are wonderful in philosophy, theology, emotional support, but we can't expect them to know everything. But we do know is that we can, as medical community, be there to back them up and give them their education. So that is where our commitment goes together with the clergy. So bioethics, that is what we consider now today the subject matter that is essentially the information that we provide as a collaboration between the clergy and the medical community. And these Catholic bioethics are designed to define our moral obligation in the case of certain illnesses. And the obligations encompass three main things. We're not supposed to commit evil, do not do evil in the name of charity, and do not correct others out of charity. Three elements have to be met in order for an action to be moral. The object of the action, what is directly chosen. This is all a little complicated. I'll clear it a little bit more. Intention, what is the reason that an action is chosen? And circumstance, what is the situation that this particular, let's say, event it involves. And when I talk about a situation, let's talk about the need for surgery, the need for medical treatment, and how does it go along with our beliefs as a Catholic Church. And it also goes along with other conditions, such as, I believe somebody asked a question today about what happens with the commingling of ashes. I think somebody mentioned, I don't know, I kind of heard it earlier. And that is something that we help to clarify with the church, and something that is maybe not a true understanding, but we do know that respect for the human, including after death, involves a respect for the remains of that body. So commingling, as I've heard it said by a clergy member, actually violates that respect because it's going to an emotional need that is really something that is not really backed up with an individual respect of that body. Now, I'm not an expert, I'm just kind of sharing this with you, but that is something that, because it was brought up today, I'm going to bring it up to the Catholic Bioethics Center, and I'm going to ask them to come out with a real statement on that as a recommendation to the different parishes and to the medical community so we understand what that means, because that is a very good question. We don't want to do what's wrong. We want it to be a good action based on good reasoning, not a bad action for good intentions. And when I talk about what I just said, bad intentions, I'm referring to the principle of double effect. This was a very hard principle for me to initially understand when I first started researching this. And the thing is, we all have an innate desire to do good, to be helpful, to be charitable. We want to be of service to the people we love and the people that we may not necessarily love, but we want to be loving too, because we are Christians. And what we have to remember is that sometimes in trying to achieve a good for somebody, we recognize that the good comes with unintended bad consequences. And we are given the option of considering these things in order to really determine if what we are doing for the person is right and natural and follows natural law. We have to consider that the act itself is good or at least neutral. Only the good is intended. The evil is never a means to the good, and there is proportionally grave reason for acting. I don't expect you to understand this right away. I want you to go over it after we've had our talk today. You may have to refer back to the notes. But what I want you to understand is basically the first thing. The act has to be in itself good. And let me give you an example. A woman, and this is a very common example, which is an easy to understand. That's why I'm going to pick it out. A woman is pregnant. She is currently 18 weeks pregnant, or let's say 18 to 20, almost 5 months. She gets told that she has a cancer, okay, and the cancer is in the uterus. Okay, what do we do now? The baby is too young to be delivered safely, but the woman will die, and she has 6 kids at home if she doesn't have the proper treatment. Her oncologist gives her one of 2 options. You can have a hysterectomy and staging. A hysterectomy is removal of the uterus. Or you can have a strong chemotherapy and possibly later on followed by hysterectomy. So the woman says, well, what happens to my baby? And in both cases, the baby will die. So what is the answer here? Well, let me tell you what the answer is. You can go ahead and do the hysterectomy, the doctor can, with the baby in there. In the process of doing the hysterectomy, the cancer is taken out, the baby dies, but the woman is saved. Same thing with the chemo. Chemo it's given, the baby dies, the woman lives. And what was the bad action? The bad action was the baby died. What was the good intent? To treat and save the woman. That is accepted as appropriate treatment by the Catholic Church because the intention was good and the result is good, we hope, but the evil that came out of it was the death of the baby. So when people tell you that the Catholic Church does not believe in saving a woman's life because she's pregnant, that is not true. It is very obvious that this has been shown to be what's done. So let me give you the example, that same thing, what is not correct. The thing that happens here is that the doctor, because I'm telling you, my peers, the doctors always say this, and I know why they do it, but I'll tell you guys in private later. I don't want to go on the record for saying this. But they often recommend that the woman have an abortion first because they won't do the surgery or the chemo because they're pregnant, okay? And they insist that this be done. So women have to go and have an abortion based on what the doctor recommends in order to get treatment. And that is where that is not allowed. And why is it not allowed? Because the evil is done first. You kill the baby, you terminate the pregnancy in the name of saving the woman where it was not necessary. And at times, interestingly enough, if you do an abortion, you might actually change her staging, which is not always told to the woman, okay? You can change her staging, meaning instead of having a contained cancer in the uterus, you might end up with spreading the cancer as you're trying to deliver this pregnancy that they don't want to be around. And then you've changed her treatment all in all, as a whole. So that is the evil precedes the good in the name of doing the good. So the evil is never the means to the good, is the one you would violate here. Does everybody understand it? Was it a clear understanding? Yeah? It's clear when you go through it in that particular, and that's a simple one. There are harder ones, but the harder ones are what we can answer and help your clergy, because we understand this. And when I say we, it's the doctors and the National Catholic Bioethics Center, which I talk to all the time when I have a question. So, in the face of death, for many, when hope seems lost, the church witnesses to a belief that God has created each person for eternal life. So we have to, this is what we're talking about in end-of-life decisions, which are other decisions where we have to look at the principle of double effect in this specific area. Each person is equal in dignity to any other, and we consider this the inherent dignity of human life. I gave you an example of a life, of the beginning of life. Now I'm going to give you an example, talk about more of end-of-life decisions, which is now the current theme that is very troubling to a lot of people. Humanity is a given stewardship over life, and life is a precious gift from God. We believe as Christians that we are not the owners of our life, and hence we do not have absolute power over life. We have the duty as Christians to preserve life, to use it for the glory of God. And the duty is not absolute, however, to reject life, because we don't have to take procedures that are life prolonging, that are not really something that is going to benefit us or our families without incurring a lot of burden. And one of the things that's very, very important in our religious beliefs is suicide, euthanasia, or assisted suicide are never morally acceptable options. In this country, we see more and more states going to this in the name of doing good. And we stand as Christians to say it is not doing good if it does it just for convenience or not respecting that human life. 6 principles that every Catholic should know regarding these end of issues are listed here, and I'll just go through it really quickly because you can read it later on. Human life is always good because human life flows from the creation in the image of God and from redemption by Jesus Christ. And the common destiny is to share life with God beyond all corruption. We respect the good of a person's life by not killing and by offering care. I apologize for that mess up in the slide. The 5th commandment, you shall not kill, is something that we should always remember in everything we do. And we remember to revere life, love life, and foster it. The underlying evil at issue in the assisted suicide and euthanasia is the belief that human life is no longer a good. That's the most important thing you can remember. A life which would require greater acceptance, love, and care is considered useless or held to be an intolerable burden and therefore rejected in one way or another. That is the fundamental belief in the presentation of this as a solution to someone's problem or someone's illness or someone's age. And we have to remember that in this country, there is an increasing number of the aging population. And we are going to see in the future a big push towards euthanasia, physician-assisted suicide, in the name of decreasing the population. And that is something that we are going to have to face. Our generation, the current one at our age right now, has to face that because we are not going to be considered valuable. Persons who commit suicide are capable of eternal salvation. We know that. The Catholic Church believes that because it does consider that disturbed persons who commit suicide sometimes are not entirely responsible for their actions. They're confused, emotional, to the point that they do this. So not all people who commit suicide are quote-unquote destined to go to hell. All suicidal expressions should be regarded as pleas for life-affirming help, not death. So we are committed to helping the depressed person treat that person so that we can prevent their push to committing suicide. We are not required to sustain life by avoiding death at all costs, since life is not an absolute good in all circumstances. We want death to come naturally rather than fighting it with aggressive, burdensome measures, and that may serve more of a value important than securing a precarious and painful prolongation of life by making way for a serene and Christian acceptance of death. Well, let me explain what I mean by that. When a person has an illness that creates a physical, emotional burden that is going to make that person live a very painful life. That person does not need to choose life-sustaining measures to continue that life. An example are people with ALS. Their life is progressively worse, right? Their minds work, but their bodies don't. They're perfectly cognizant of the fact that they cannot eat, swallow, move, express themselves. Completely cognizant, able to make a decision about their lives. Their bodies do not respond. So if a person like that says, I do not want to be resuscitated, or I do not want to be intubated and kept on life support, that person has that right to do that because their bodies have deteriorated to the point that there is no solution. And that emotional burden on them, being trapped in a body that cannot do anything, is considered by our church and medical community a perfect reason to allow that person to not accept life-sustaining measures. Another example, a person with kidney failure. A person with kidney failure may need dialysis. Dialysis is an extensive burden on some people. It could be financial, it could be emotional, it could be physical, because the more people require alterations to their bodies to be able to have dialysis, the more they become, it is a painful solution. So these people are allowed to say, no, I do not want dialysis. And it is accepted by the religious community and the Catholic Church, because it is a burden that puts an undue pressure not only on the patient, but on the family. They are not choosing to kill themselves actively, they are choosing to not accept other treatments, which makes life burdensome. Hospice and good pain management are also well accepted by the Catholic Church, and this only if it respects the lives of dying persons, and that should be encouraged. You focus on comforting, but you do not focus on hastening death. My husband and I always get nervous when a patient chooses hospice or a friend, because we know that traditionally, the minute someone goes on hospice, within 2 weeks, they're gone. They may have been okay for 6 months or whatever, gradually getting worse, and then all of a sudden they go into hospice, perhaps because it was more affordable to go into hospice. It covers all your expenses. And by the way, hospice can be extended to a year if needed. But always that person dies within 2 weeks. And you know why? Because many of the people who treat these patients who are in hospice have predetermined in their mind that these people are going to die anyway, and we're okay to go ahead and give them something to push it a little sooner. They may have the intention of helping, but then they give a dose of morphine that actually stops people from breathing. So I always caution people, when you have a family member that goes into hospice, you have to give strict criteria to the doctor in charge of the hospice and the nursing people that are in charge of the hospice, that you want the guidelines of the Catholic Church followed. You do not want any quote-unquote super comfort care, which is what's going to hasten the death. Death is a natural and inevitable end of biologic life. And the death of the total brain, including the brainstem, is the death of an individual because there's no longer present a human organism, which depends on the functioning of the human brain. And I have to tell you, Father Tad Paholczyk, who is at the National Catholic Bioethics Center, he continues, he's a neurophysiology scientist, and he continues to look at the definition of death, because we used to call brain death death of the cerebrum, which is the front part of the brain, and now we're finding that there's other things that truly determine the death. So this is a very difficult one, and again, when faced with this, we need to really confirm that our family member, friend, does not have true death by those definitions. And that's a very complicated one. It's not as easy as it used to be. In end-of-life situations, one does not will or cause a death, but merely accepts the inability to impede death. Again, we're going over the same thing. And it's important to make a distinction between the ability to impede death and the will to cause death, which is now considered euthanasia. Medicine is rapidly advancing. It is supposed to give people the advantage of living longer, safer, healthier lives. However, there are complex issues arising from these treatments, and the Catholic Church gives us basically a guide to these treatments, and that's what we call the compass of the path of dying well. A person has a moral obligation to use ordinary and proportionate means to preserve life. And what these are those are the means in the judgment of the patient offer reasonable hope of benefit, but do not present an excessive burden to the patient or an expensive to the family or to the community. So this is what we want to look for. This is what we call an unburdened assistance to life. Proportionate care would mean something that is unburdensome, gives you hope of benefit, it's commonly used, like for example, chemotherapy that is well tolerated, not too difficult, reasonably simple, and goes along with one's status. In other words, with one's age and one's capacity to tolerate. I don't want to give you a medicine, or I won't take a medicine that's going to make your quality of life so bad that it's just, you can't enjoy your family. We don't want that. And if an oncologist wants that for someone, we have to be strong and say, no, I'm not taking that. I would rather enjoy the 6 months with my family, completely happy and able to do things until I can't, but I don't want this medicine that's going to make me so miserable I can't come out of my bed. Disproportionate care is things that are a certain impossibility. It requires a lot of effort, a lot of hardship, like I just told you with the chemotherapy, excessive pain, and the cost of it is so high that you're going to leave your family destitute. When I look at people with ALS, yes, they get care by their Medicare benefits, but when you look at what the patients have to pay sometimes to get the care that they need, new special cars, special wheelchairs that may not be covered by their insurance benefits, that is an excessive cost to the family that may need that money for future health care, for future living. And those are the things that people need to consider as disproportionate care. And again, when you look at a treatment that gives you intensive fear or repugnance, that's an emotional burden on you that makes your quality of life also a problem. And therefore, the Catholic Church does look at that as something excessive and should not necessarily be accepted. Ordinary it's basic care which the patient needs to live: hydration, nutrition, and shelter. Extraordinary are medical devices or interventions for maintaining organ function, blood pressure maintenance, maintaining core body temperature, heart-lung machines, ventilation, dialysis, I mentioned. These are considered things that may be too burdensome. So why do it? If we refuse extraordinary means and we use, or we also like to use extraordinary means, even if they are at the experimental stage, they are not without certain risk. The Church says that you can interrupt these means if they fall short of your expectations. If you take a chemotherapy that is, let's say, experimental, or maybe a surgery that's experimental, and you find that it really did not give you the benefit that you thought it would, there were complications, it's okay to say no even if you started. And that may be a reason to stop it. It doesn't mean that because you accepted something that was new, that you now feel that you have to stick with it or you did not follow the Catholic teaching. Once again, we need to consider whether or not any treatment, surgical or otherwise, is giving you strain or suffering outside of the benefits that you anticipated. And the Church understands that. It gives you the option. One thing that is non-negotiable is that we are not free to neglect ourselves by withholding artificial nutrition and hydration. A lot of times in the hospitals, patients are not given nutrition and hydration, especially if they're in a coma, because they feel the doctors or the staff feel it's not necessary. But we as the Catholic Church believe that it is necessary, because that is a normal thing for us. We must feed ourselves, hydrate ourselves. It's interesting, if you sign advanced directives in the state of Texas and you don't look for the Catholic one, you will find that in there they do not include this. You have to get the Catholic one. You have to search for the one, because there you can tell the person in charge of your life, when you are not able to give advice or give your opinion, that you will ask for adequate nutrition and hydration, because that is a basic need that we cannot withhold. And we need to do this. And I advise you to always have that in the back of your mind when you talk to your loved ones, your children, whoever who's going to take care of you if something happens, that this is a basic thing that's important to you. There should be a presumption in favor of providing this, including patients who require medically assisted nursing care, as long as, with the nutrition hydration, as long as this is of sufficient benefit to the patient that outweighs the burden. And I'm going to tell you that most of the time, nutrition hydration is not a problem. The problem comes when you have a patient that cannot take nutrition in the form of, let's say, I'll go back to my ALS patient because that's the easiest one to tell you, but there's others. When they have a feeding tube in their stomach, if you give them nutrition through there, they can live for a long time. But there comes a point where their muscles from their mouth to their stomach become so weak that when they lay down or they're laying down, what goes into the stomach goes right back up and they aspirate. Aspirate means the food goes into the lungs instead of staying in the stomach or in the GI tract. Gastrointestinal tract, sorry, I use these terms sometimes, I forget that you're all not medical, but gastrointestinal. And so what happens is, if you try to give fluid through there, then you're actually making their lives worse. So you're forced to either give intravenous, or which is IV here, or you stop giving nutrition through there. And a lot of patients prefer to not have intravenous because it's painful, or they can't find veins, and they would require extra surgery to find a place to give them the venous fluids, so they elect to not have them, because if they're going to live 2 weeks without eating, those 2 weeks are quote unquote more comfortable. They're not aspirating. And you're not hastening the death, because if you aspirate, you get a pneumonia, and you could die from the pneumonia within 24 hours. So those are the little details that really you need to talk to somebody about to understand how we can help these patients. And again, we can decline to have all of these cares, including a feeding tube, if it goes with the whole thought of making your life worse. Again, we measure the burden versus the benefit, and we always choose where the benefit exceeds the burden, and then we understand when the burden exceeds the benefit. So again, we will withhold burdensome treatment when death is imminent. Death is an unavoidable end. Patient should be allowed to die if all these criteria are met. And death is as a result of terminal pathologic condition. Decision depends on the time, the situation. I always give an example of us not, when we're older and we consider ourselves burdens, we don't want to give a burden to our family. And I want to consider these things. We don't want to be a burden, but yet we have to consider, what does that burden do to our families? Well, we should not make this decision if we're depressed about our condition. When you have a condition that you know, pancreatic cancer, advanced terminal cancers, yes, we are depressed that we have it, we have to go through this. But we need to understand that there is a reason for that, and we choose when it becomes a burden, and then we decide to go forward or to not forgo any more treatment. The most important thing you can do when you get to that point is to tell your loved ones where you are, where your mind is, what you want done, specifically what you want done. You designate someone that will respect your thoughts. If you do not want to be intubated, resuscitated, that person has to respect you, because especially family members who don't want to see you die may want to actively interfere, and they may not want to let you die. So you don't pick the daughter or son that feels that they know better than you do. Okay, fully respecting all these other ideas. And you have to have a medical power of attorney to that person. It overrides anything else. And I remember that the funeral directors mentioned that, I hope I called you correctly, maybe I didn't, that whatever you write will be what will be followed. So you have to be specific. And your family members will have to respect it. And you have to have someone who is strong enough to stand for what you believe. You don't get the wimpiest daughter or cousin to do that. You have to get someone strong. Euthanasia, physician-assisted suicide, medical aid in dying, these are all the same terms that we are using today. We know that it is a form of mercy killing, and the church views this as absolutely wrong. Remember that God is the person who gave you life, that God has entrusted your life to you, and you should live according to his plan. And suicide is as wrong as murder, and it's a refusal of your own self, and it's a denial of the natural instinct to live. Talked about these two. Euthanasia is actually actively killing a person, physician-assisted suicide. The whole term really bothers me because the Hippocratic Oath said that we would never do this, and yet physicians do now under public pressure. But it is a direct violation of our Hippocratic Oath. The value of suffering is looked on as there is a value because of the fact that we get redemptive benefit from this suffering. And we mimic Jesus' suffering when we go through our own suffering, as long as it is not an undue burden. I always go back to that. Jesus didn't determine how much burden, in a sense, because he had to go through it. He could have avoided it, but he accepted it. But at the same time, we sort of have a little more control, but we have to be honest. Is it really a burden or not? What is the value of suffering to your family members? Well, if you do not allow yourself to suffer, you rob your family members of the opportunity to show their Christian love for you, because they need to show you that they love you. They need to take care of you. Most importantly, I think, in this particular group is what we teach our younger population. Our younger population generally has everything that they want. They have it all at their fingertips with the cell phones and with all this technology. What they don't have is a lot of interaction with the older population where they actually take care of them. We all took care of our kids, grandkids, and we want them to have the same opportunity to take care of us, because it builds their ability to love themselves, love each other, and to have that sense of self-sacrifice and not be selfish. I want you to read this on your own, but basically what I want to tell you is that if we accept euthanasia as a common custom in this country, we become as bad as Canada and other countries where now human life is not valued, and patients are now given the option for euthanasia, physician-assisted suicide, before they're given the option to pay for life-saving chemo, surgical, or other medical treatment. And this is where we cannot even start to go that way, because it ends up the other way. It's an interesting point, and I'm probably going to go over a minute, and I'm sorry, but this is important. I hope y'all don't mind. The physicians in Canada currently are all healthcare physicians that are hired by the government. If you do not offer physician-assisted suicide and euthanasia to the patient population that has a terminal illness or even a difficult, expensive to treat illness, you will lose your license. If you claim religious beliefs as a reason not to do it, you cannot practice medicine in Canada. So just be aware of that. So unless we as a population say we will not accept this as a practice, that can happen. So palliative care is good. It focuses on the good, make the person comfortable, does not extend a burdensome situation. And hospice, again, as I mentioned, something to be accepted. Okay, so I am going to quit a little early because I'm actually over. Thank you very much and I will take questions later because I spoke over my time for questions. I get that. I'm going to be around in the back if you guys want to come and ask me something. I know I said a lot. This is usually an hour-long lecture. I tried to consolidate it. I hope you all understood everything.